Hello and welcome to the Valley today. I am your host, Janet Michael. We are back on the Zooms today with Kelly Botta. Kelly is a board-certified physician assistant and president of Smartypants Medicine. She joined us for the show back in October of 2022. And Kelly, a lot has changed in just a couple of years. You've grown quite a bit since our last conversation.
Yeah, it's been a really exciting time. I think our practice is really unique and different and something our area has responded to. So it's been awesome. Thanks so much for having me back on.
So, for someone who maybe didn't hear our conversation way back then, can you give me a refresher on Smarty Pants Medicine, who you are and what you do?
Sure. Like you said, I'm Kelly. I'm a physician assistant. I've been practicing in internal medicine for about 15 years now. Had some experience in the ER and urgent care and decided to start a practice that's called direct primary care. Basically, the idea is it's healthcare that's more convenient, more affordable, and focused on you, all for a simple monthly fee. So it's a low cost way to get health care, and it's been absolutely incredible. I get more time with my patients, and we are not rushing through visits. People have loved it.
It seems so incredibly convenient that I can't imagine anybody would think it was a bad idea.
It is, it's really neat. In fact, I wasn't sure when I first heard about it whether it was real or not. And so that is part of the way that we got our name was I just thought, wow, this was the smartest thing I had ever heard in the way to deliver healthcare. And we are able to text with our patients. We email with them. We guarantee same day and next day visits, which is a big deal in healthcare today because getting access or getting in to see somebody is a problem. We do not have enough healthcare providers and professionals to handle care across the country. So having great access improves people's health outcomes, and it certainly is convenient to be able to fire off a text instead of having to go through a big phone tree.
I would imagine that you have found people are more apt to reach out when something isn't feeling right or they're not feeling 100% because it is easier to be able to have that conversation with you and be seen and not wait months and months.
Yeah, and I love that you brought that up because what the research shows is that improved access, which is getting care when you need it, it lowers overall cost to healthcare in the healthcare system, it improves health outcomes, and it lowers mortality. And those are all really good things, both for the individual and for our country at large as a healthcare system. Delivering care this way is amazing. It highlights something that we're really passionate about, which is preventative care. We want to really be partnering with people to stay healthy and not develop chronic disease. Two conditions is what each adult in America has on average chronic conditions. And I would venture to say that that's a couple of years old data and that it might even be higher than that. And so, what we are really looking forward to and what have been doing is spending time with folks to really educate and find areas of opportunity where they can improve their health and reverse their disease or make sure we're looking a decade ahead and what can we be doing to prepare for the future. What foods do we need to be eating? How do we need to be exercising? Maybe they are on medications. How can we adjust those to minimize side effects or maybe get off of those entirely? And so, really, our bodies are really complicated, and medicine is very specific to each person. And so, this gives us an opportunity to personalize their healthcare and really get after some root cause issues and make a significant difference in people's lives.
I think when we spoke back in 2022, it was just you. This was something that you were doing and you were the one seeing patients, but you've even grown and added people to your office now.
Yeah, that's right. We have another provider now. Her name's Colleen Shendo. She is amazing. She's another PA who's been in internal medicine for years and years. Very wonderful to work with, and she's well loved in the community. She's been here for quite a while. She was born and raised in Berryville. So we're excited to have her as part of our team. And we've got two admin assistants that are helping us now as well, which is, as you know, a business owner, so great to have the help. And so we also got a new location. So we started off as a house call only practice, and it got so busy that I was really not able to take on everybody that wanted to be seen driving around everywhere. So we got a location right in Winchester, and now we're able to serve. I still house call, so we still do that and we still offer that service. But this also gives us a way to serve a greater number of people in the area who are interested in this type of care.
When we're talking about you and Colleen being physician assistants, what does that mean in the grand scheme of medical care?
It's a good question. So PAs are physician assistant. They recently went through a name change called physician associates. So we'll see if the law picks that up. But yeah, PA is the easiest thing to say. And in primary care, it really is not a difference from the patient side and how they experience care. We're able to do everything that a physician does, and similar to nurse practitioners, right? All three of us are advanced practice providers, healthcare professionals. We're trained in the full scope of internal medicine. We can diagnose and treat, we can write medications, we can interpret EKGs, we can do procedures. The full service of primary care is what we're able to do. Obviously, we take national exams and stay up on our CMEs just like the physicians do. And we do work in collaboration with physicians, as that's state law across the country. And so we comply with all of that. But it's a really awesome profession because there's been a shortage of physicians for over 10 years now in primary care. And folks just are not going into that field. And really, primary care is the gatekeeper to everything else in healthcare. If we had more primary care providers in our country, we would save the US healthcare system billions of dollars. It's hard work and it's not a field that a lot of folks are going into. And so as PAs and NPs, we're really able to help bridge that gap and improve access to care. So it's a win-win because I love it. I love the longitudinal care. You're walking with people through years and years of their life. You really have great continuity. You know these people, you walk into the room, you can tell by looking at someone that you know whether they're feeling well or not. And so it's a really neat way to practice medicine and I just love it.
It seems like it's almost a throwback to ages and ages ago when you did have that primary care doctor that was the hometown doctor. And if you needed him to come to the house, they would. And they knew you and your kids and your parents and all of the things. It seems like it's the epitome of what medicine used to be like.
Yeah, I think that's really perceptive of you because I feel the same way that it's old school healthcare with new technology. And so we're leveraging the awesome things that we have, like telehealth and like texting. We're leveraging all of that. And at the same time, we're not losing the humanity and the personal side of healthcare. I think, unfortunately, over the last 15 years, the way healthcare has gone, we call it kind of healthcare 2.0, it kind of industrialized healthcare. And so they took on this lean model and everything was how do we become more efficient? And in doing that, we lost a lot of the personalization and patients really feel that. And us as healthcare professionals, we feel that too. And it's not really what we're going for. There are studies that show that there's therapeutic benefit to the relationship between the patient and the provider. And so if you're in and out of the office in 7 minutes, which is the national average for FaceTime with your provider when you go to a visit, you really don't have a lot of time to build relationship or even to address one issue, let alone multiple acute things and then your chronic health concerns as well. You're right, it is a throwback and it is really welcomed.
The relationship that you have with your healthcare provider is probably the most personal relationship that you have with any other professional in your life. So it really solidifies that when you're using someone like you in Smarty Pants Medicine.
Yep, I tell my patients that all the time. If you're not a good fit with us, it's okay. There's a lot of brilliant other professionals in our area, and we can send you to them because it matters that you fit and that you're comfortable with your healthcare professional because you need to tell that last 10% that can sometimes feel a little tricky. But if you aren't comfortable to do that, oftentimes we miss the diagnosis and it ends up impacting your health. And so it's very important that you feel comfortable and that you feel heard and that you have time. And so we are able to do that in this model in a much more thorough way than in a traditional setting.
And I'll bet that a lot of people don't even realize when they go see their primary care physician. You mentioned that 7 minutes, 5 of those minutes are usually spent with a PA. They're usually the ones that are doing the intake and getting the information and then telling you what to do afterwards and giving all the information to the doctor himself. So they're already
Yeah.
seeing a PA in a lot of ways.
Yeah, it is a little bit of a misconception with the title of our profession, PA. We actually do carry our own patient panels, and so we don't have to consult on every case with the physician, and most PAs do not once they're experienced. The first couple of years when you're coming out of school, you have a lot more oversight and supervision, but just like any profession, the more proficient you get, you don't really need that too much. And so many of us are used to seeing hundreds, if not thousands, of patients that are strictly ours that we manage, and then we pull the physicians in if there's something really complicated or we need a second opinion on. We feel like maybe it's outside of our scope of what we were trained in, and then we can transition them over to the physician care. But almost everything at this point in primary care, we can manage just the same. And so it's been really neat because there are so many people who do have the experience where they feel rushed or they feel like when they need to be seen, they can't get in because the schedules are just so full. And it's really nobody's fault. It's just that there's really high needs for healthcare, and we just don't have enough people in the industry. So we intentionally keep our practice small. We keep our panels small intentionally so that we are able to give adequate time to our customers who are on a membership with us.
On that note, let's take a break. When we come back, let's talk about the membership and the logistics of it all, how it works. If someone listening today wants to call you for the very first time, can we get in the weeds on that in the next segment?
Would love to.
We are on the Zooms today with Kelly Botta. She is a board certified physician assistant and president of Smartypants Medicine. We're going to come back and learn how that works in just a couple of minutes.
Don't let a cringy DJ ruin your wedding day. Celebrate confidently instead with Summit Events Co., the premier entertainment company in the Shenandoah Valley. Summit Events is serving 200 couples a year with 5-star reviewed DJs, photo booths, 360 booths, live music, and more. You can celebrate confidently with Ben Savory, Summit Events founder and chief party officer, who was just named the Top of Virginia Entrepreneur of the Year. Don't risk your wedding. Book a professional at summiteventsco.com. That's summiteventsco.com and on Instagram at Summit Events Co.
Welcome back to the Valley today. I am your host, Janet Michael. We are on the Zooms today with Kelly Botta. Kelly is a board certified physician assistant. She's also president of Smartypants Medicine. We met her for the first time back in October of 2022. A lot has changed. She's grown quite a bit in the last couple of years. So, Kelly, for someone who's listening for the first time today and they're like, I did not even know this was an option, what is step number one? How does it work?
Thanks for asking. So we have a great website, smartypantsmedicine.com. You can go on there. There's a 1-minute video that kind of explains and gives you a quick summary of what this is. And then there's also an easy button on there that says sign up. And you click on that and do a quick online enrollment. That's how you join the practice. Our admin team will reach out to you. They'll schedule you a visit. We are only scheduling a couple of weeks out as opposed to months out. We're really trying to prioritize keeping spots for access to care like we talked about earlier. And then once you get your appointment, we spend an hour long on your initial visit. We talk about your health goals. We talk about your preventative care. We talk about all your chronic care. We set together a plan of what you want to do with your health and what that looks like. And that might be, we check in every 6 weeks if you've got goals that you're working on. It might be that you just want to know that whenever you're sick, we're going to answer the phone. And so we talk about that and what your health goals are, the services for you. From that point forward, we're on call for you. And so if you have a health issue, you just send us a message, email, call, text, and we get you taken care of the same day or next day. So it's very easy. Just hop online and click sign up. Also, just want to mention that we do a free 15-minute kind of discovery call. If you are not sure or you have certain questions about your situation. Like I said, healthcare is very personal and it's a complicated industry. And so if you just want to ask your questions before you sign up, we are happy to do a complimentary 15-minute call. And there's a form online that you can request that as well.
Is there a limit each month? So say I get a membership and I'm paying this fee. Can I only call you 3 times? Is it 10 times? Is there no limit? How does that work?
Yeah, so actually, there's no limits on how often you can be seen. We basically designed it's a similar type of healthcare that you're not used to getting. It's just that we have more time with you. And the payment model is really what sets it apart, time and payment and convenience. And because we do a low monthly fee, it enables people to budget for their healthcare over the year. And so we don't charge you like an attorney does for every minute that you're talking to us, or you never pick up the phone then because you don't want to get billed. And so that's not what we want to incentivize with our health. We want to incentivize engagement and early treatment. And so whether you need to be seen 4 times that month or no times that month, we do a 1 flat monthly fee. And the idea is for us as business owners, that keeps our revenue coming in steady. And for you as a patient, that helps you budget for your healthcare. So you're not getting surprise bills, you're not getting huge bills that you were not prepared for. And you know that you're going to be able to afford your healthcare. It's really important that people seek treatment early before their situation worsens. And so by taking away that payment barrier, it really helps improve health outcomes.
I would imagine that it's a great option too for small business owners that maybe only have 1, 2, 3, even up to 5 employees on staff, that having traditional health insurance is so crazy expensive these days. And not everybody needs that level of the insurance for the cost that it is.
It's been really interesting, Janet. Yeah, I'm glad you brought this up. So, when I got into this and I started the practice, I didn't even have my head around how awesome it could be for local small businesses and employers. And it's something that I've learned over the last 5 years. But we currently partner with several businesses in the area from 10 employees up to 300 employees. And so it's neat because it can serve different businesses in different ways. And like you said, for entrepreneurs or people who are contract employees or small businesses who are priced out of the healthcare market, they can pick up our membership for a low flat rate. And at least it's a first level care, right? We can get their meds refilled. We can take care of all of their urgent stuff, all of their chronic stuff, all their preventative care. And then we always recommend that people get health insurance because we can't do surgery for you. We can't take care of you if you end up in the ER. And so that catastrophic care really is important. And so we always recommend that you pair our membership with some type of a catastrophic healthcare plan if you can afford it. A lot of small businesses do that, right? They will actually cover our membership for their employees. They want to keep their people healthy. And when we are with them, we are going to help do that much more effectively. And so they'll cover our membership and then they'll cover a catastrophic healthcare plan. And that's a high deductible healthcare plan. And then the larger companies who are able to do partially self-insured, I don't know if this is a whole big market, people may or may not know, but the business owners who are listening, if you're able to do a self-funded or self-insured health insurance product for your company, we can really partner well with these plans because we reduce their claims and their out-of-pocket costs. And so we're lowering their healthcare cost and we're improving the value of their healthcare. So it's been a really neat and exciting area for me to learn as a business owner and a healthcare professional that not only are we serving individuals in our community, but we're helping bring down the cost for our local employers as well.
You bring up a good point when you're talking too about having some sort of other coverage for a catastrophe, large or small. So I could fall and break my leg, or I could trip over these dogs and sprain my ankle. You're not going to do the x ray, for example, yourself. You're going to send me somewhere to get that x ray done. That's where that extra stuff comes in handy.
Yeah, you're absolutely right. One of the neat things is with imaging and with labs, and really with any of the testing that we order out of our office, we have worked really hard. Our team has worked really hard at finding out what the actual cost is if you self pay for these things in our area. And that's pretty unique in healthcare because there's not really standard pricing. It's one of the only industries where there is no transparency in pricing. The pricing changes depending on which insurance company they're getting payments from. That is one thing that I think is detestable about the healthcare industry, and I think it needs to change, hopefully, in the near future. But price transparency is a really big deal. And so we're able to do that with cash pay pricing. And what we have found is that self paying and not using your insurance is often cheaper than using your health insurance, especially for folks who are on a high deductible plan and they're paying so much out of pocket. So we actually are able to add value by telling our patients, if you order this test, here's how much it's going to cost if you want to pay out of pocket. If you want to use your insurance, you're welcome to do that. And then that empowers our patients to make a decision that fits their financial situation and that works to their benefit. So I'm very proud of that. And it's a way that we can really be respectful of people's finances and stop bankrupting people with healthcare expenses because 40% of the country has healthcare debt. And I think that's really something that we need to move the needle on.
Imagine how much of a time suck it is for somebody who knows they need to get an x-ray or a lab done and they have to call all of these places that offer that. They're not always even going to get an answer. Sometimes if a regular person calls and says, "Hey, how much is this?" they get a runaround or they don't get an actual answer. So you're saving them a ton of time by having that information at your fingertips.
It's true. And because we're in the industry, we understand what questions to ask. And so we know if there's going to be additional fees. Certain services, it's the service fee. And then if there's a facility fee, and then there's a professional service fee, and then there might be pathology fees. And so because we've been doing this and it's what we do, we can help patients navigate that and just be more prepared. We're never going to not order something because of finances. But if it's a non-urgent test and we can be good financial stewards and be sensitive to that, we never want to order something and then have someone not be able to make their house payment the next month. There are ways around that, and we need to do a better job. And in this model, we're able to be a little bit more mindful of that.
Is there an age range of patients that you see? Do you see children? Do you see senior citizens? Explain some of that to me.
Currently, we are seeing patients age 16 and up. We are internal medicine practice right now. I would certainly love if anyone's listening and is a pediatrician and wants to join us. I would love that. The truth is, Winchester is a pretty hard area to recruit to for all of us, whether you're a big, large multi-physician group or even the health system locally or a private practice. Yeah, we would love to be able to offer pediatrics, but right now we serve patients age 16 and up, and we've been able to really fill a gap in that space that hasn't been there before.
We talked earlier about people not understanding that a physician assistant can do a lot of the same things, most of the same things that a primary care physician can do. Are there other misconceptions that are out there when you tell people, oh, this is who I am and what I do? They think it's something totally different?
Yeah, man, I could probably go on a while about that, but I think that a lot of people think because they have insurance that that disqualifies them for our practice, and that our practice is maybe only for patients who are uninsured. I hear that a lot. And while we do serve the full scope of patients, doesn't matter if you have insurance at our practice or not, we actually do not bill the insurance companies. So we are a total self-pay membership practice. We have about 80% of our patients who are insured and have traditional health care, and they add us because the convenience and the access and the value is so high that it's worth the money. It's less than the cost of a gym membership. It's less than the cost of a cell phone. It's less than the coffee bill some people have every month. And so I
Are you
think
calling me out? Are you literally calling me out
I'm
right
not
now?
sure if that's you or not, but our health is really important. And if we don't pay for it now and we don't invest in ourselves and our health now, we're going to pay for it later in the form of chronic disease and the illness and the disability that it ends up having in our bodies. And I just encourage everybody, invest in yourself now, work with professionals who really want to see you well and are motivated to do so. And we are here in the community to do that.
How do people reach you? Is it best to check your website first? Should they call? Can they just stop in?
Probably through the website is the best, through the form there, or you're welcome to email me. My email is kelly@smartypantsmedicine.com. We also have a team of people that help field all the inquiries from the website. So that's probably the most efficient way. Of course, you're welcome to call. Stopping by is a little bit tricky because we are a concierge model practice. We are not open standard hours. We are open by appointment only. We have a locked entrance. We are set up very intentionally to serve our clients, and stopping by is a little bit tricky, but the other avenues would work well.
Well, you mentioned earlier you are still doing house calls, so there's no guarantee that you're even going to be in the office on a random
That's
day
right.
or time.
That's right. Yes, exactly.
So tell me your web address one more time.
Smartypantsmedicine.com.
Thank you for meeting up with me today and giving me an update on all of the things that you offer. This is really impressive. I am really happy to see that you've grown so much since we last spoke.
Thank you so much. I appreciate the opportunity to let the community know that we're here and we're here to serve.
I will be back tomorrow with a brand new episode of The Valley Today, a few minutes after noon, so meet me here then.